If you are over 60 and you think a heart attack always feels like crushing chest pain like you see in the movies, what I am about to tell you in this video could save your life. My name is Dr. Robert Vance, and for over 20 years I have treated thousands of senior patients. And the single biggest mistake I see is this: seniors ignore the real warning signs because they are waiting for a Hollywood heart attack that never comes. And by the time they realize something is seriously wrong, it is often too late. Today I am going to share with you 6 silent heart warning signs that most seniors over 60 have no idea about. These are symptoms that happen days, weeks, or even months before a heart attack. And if you or someone you love is over 60, you need to watch this video until the very end. Let me start with a story that still haunts me. A 72-year-old female patient of mine, a woman with morbid obesity, uncontrolled diabetes, and high blood pressure, came in for a routine follow-up. She mentioned feeling tired all the time. She said she could not sleep well. She felt depressed. She denied any chest pain. She denied any shortness of breath. She said she felt fine otherwise. Her last heart test just 2 years earlier was completely normal. Her ejection fraction was 55 to 60%, which is actually healthy. So I treated her depression, adjusted her medications, and sent her home. 3 weeks later, she was rushed to the emergency room, unable to speak. She had suffered a massive stroke. When we did an ultrasound of her heart in the hospital, her ejection fraction had dropped from 55% to just 8%. 8%. That is not a heart problem. That is heart failure. That is a woman who was having silent heart attacks for months, and nobody knew because she never had chest pain. This is the reality of heart disease in seniors over 60. The warning signs are not what you think they are. Here is the first warning sign that most seniors ignore, and this is the most dangerous one of all: unusual fatigue. Not the kind of tired you feel after working in the garden or walking up a flight of stairs. I am talking about fatigue that makes it hard to lift a grocery bag. Fatigue that makes you feel like you need a nap after taking a shower. Fatigue that feels like you have the flu but you do not have a fever. A study published in the European Heart Journal looked at over 7,000 heart attack patients and found that breathing problems and extreme exhaustion were the second most common symptoms of a heart attack, especially in older patients. In fact, 24% of all heart attack patients had what doctors call atypical symptoms, and the most common ones were breathing difficulties and extreme fatigue. Here is what is scary. That same study found that patients with these atypical symptoms were 3 times more likely to die within 30 days compared to patients who had chest pain. Why? Because they did not recognize the symptoms as a heart attack. They waited. They thought it was just old age. They thought they just needed rest. And by the time they called for help, the damage was already done. So if you are over 60 and you notice that your energy levels have dropped significantly for no reason, do not brush it off as just getting older. That could be your heart trying to tell you something. The second warning sign is shortness of breath that comes on with very little activity. And I am not talking about being winded after running. I am talking about feeling like you cannot catch your breath after walking from your bedroom to your kitchen. I am talking about waking up in the middle of the night feeling like you are suffocating. A study from the Korean Academy of Nursing compared younger and older patients with first-time acute coronary syndrome and found that older patients over 65 were much more likely to complain of shortness of breath and fainting, while younger patients complained of chest pain and sweating. The same European Heart Journal study I mentioned earlier found that breathing problems were the most common atypical symptom of a heart attack, especially in women over 79 years old. Why does this happen? When your heart is not pumping blood effectively because of a blockage, fluid can back up into your lungs. That fluid makes it harder for your lungs to exchange oxygen, so you feel short of breath, even though your lungs themselves are healthy. The problem is your heart. And if you ignore this symptom, the blockage can get worse until a full heart attack happens. The third warning sign is something that almost every senior I have ever treated has experienced at some point, but almost nobody connects it to their heart. I am talking about nausea, indigestion, heartburn, or stomach pain. A study published in the Canadian Journal of Cardiology identified gastrointestinal complaints including nausea, vomiting, and heartburn as important warning signs that can appear hours, days, weeks, or even months before a major cardiac event. Think about that. You eat a meal, you feel bloated or nauseous, and you reach for an antacid. But what if that indigestion is not coming from your stomach? What if it is coming from your heart? The nerves that supply your heart and the nerves that supply your upper stomach and esophagus are right next to each other in your spine. When your heart is in distress, your brain can get confused about where the pain is coming from. So it feels like stomach pain when it is actually your heart. This is especially dangerous for seniors because we are so used to having digestive issues as we age. We pop antacids and we move on. Meanwhile, a blockage in an artery is getting worse and worse. If you are over 60 and you have unexplained nausea or indigestion that does not go away, especially if you also feel tired or short of breath, do not just assume it is something you ate. Get it checked out. The fourth warning sign is pain or discomfort in places that have nothing to do with your chest. I am talking about your jaw, your neck, your back, your shoulders, your arms. One study found that women in particular experience more back pain, neck and throat pain, and arm weakness or heaviness as prodromal symptoms before a heart attack. Another study from the Journal of Cardiology emphasized that elderly patients who develop heart issues while hospitalized for other illnesses often present with atypical symptoms and no classic chest pain at all, which leads to under-recognition and delays in treatment. So what does this mean for you? If you wake up with a sore jaw and you think you must have been grinding your teeth at night, stop and think. If your left shoulder has been hurting for a few days and you assume it is arthritis, consider whether it could be something else. If you have pain between your shoulder blades that comes and goes, do not just stretch it out. These could be referred pain signals from your heart. The same nerve pathways that carry pain signals from your heart also carry signals from your upper back, your jaw, and your left arm. Your brain does not always know the difference. So when your heart is in trouble, your brain thinks the pain is coming from somewhere else. This is called referred pain, and it is one of the most common reasons why seniors delay seeking treatment for heart attacks. The fifth warning sign is something that I mentioned in that story about my 72-year-old female patient. It is a combination of symptoms that often gets dismissed as stress or depression. I am talking about sleep disturbances, anxiety, and a general feeling that something is not right. A case report published in the Journal of the American College of Cardiology described a 72-year-old woman with depression, insomnia, and fatigue who had a completely normal heart test 1 year prior. But those seemingly mild symptoms were actually the early warning signs of severe coronary artery disease. She eventually suffered a massive stroke and was found to have extensive blockages in her heart. Another study found that patients who had a heart attack reported feeling anxious and having a sense of impending doom in the days and weeks leading up to the event. Now, I am not saying that every time you feel anxious you are having a heart attack. That is not true. But what I am saying is this. If you are over 60 and you notice a significant change in your sleep patterns, if you feel more anxious than usual for no clear reason, if you have a persistent feeling that something in your body is just not right, do not dismiss those feelings as just stress or just getting older. Your body has a way of telling you when something is wrong. The problem is that we seniors have been taught to ignore those signals. We have been taught to tough it out. We have been taught that complaining is weakness. And that mindset kills people every single day. The sixth and final warning sign is the most subtle of all, and it is the one that even some doctors miss. I am talking about fainting or near fainting, also called syncope. A study comparing younger and older patients with first-time acute coronary syndrome found that older patients were significantly more likely to experience syncope or fainting as a symptom of their heart problem, while younger patients experience chest pain and sweating. Why does this happen? When a blockage reduces blood flow to your heart cannot pump as effectively. That means less blood is getting to your brain. And when your brain does not get enough blood, you feel lightheaded, you feel dizzy, and in severe cases, you actually pass out. Here's what makes this so dangerous. Many seniors who experience a fainting episode assume they just stood up too fast, or they assume they must have been dehydrated, or they assume it was a one-time thing and it will not happen again. But if that fainting episode was caused by a blockage in your heart, it is not a one-time thing. That blockage is still there, and the next time you faint, you might not wake up. If you are over 60 and you have fainted even once without a clear explanation, you need to talk to your doctor about your heart. Do not let them tell you it was nothing. Ask for an electrocardiogram. Ask for an echocardiogram if necessary. Your life could depend on it. Let me summarize what we have covered today because this information is too important to forget. The 6 silent heart warning signs that most seniors over 60 ignore are: number 1, unusual fatigue that makes everyday activities feel exhausting. Number 2, shortness of breath with minimal activity or waking up at night unable to breathe. Number 3, nausea, indigestion, or stomach pain that does not go away. Number 4, pain in your jaw, neck, back, shoulders, or arms that comes and goes. Number 5, sleep disturbances, anxiety, or a general feeling that something is wrong. And number 6, fainting or near fainting episodes without a clear explanation. If you have any of these symptoms, especially if you have more than one of them, do not wait. Do not tell yourself it is just old age. Do not tell yourself you will call the doctor tomorrow. Pick up the phone and call your doctor today. And if the symptoms are severe or if they came on suddenly, call 911 immediately. The research is very clear on this. Patients who delay seeking treatment for atypical heart attack symptoms have a 3 times higher risk of death within 30 days. Do not become a statistic. Thank you for watching. I am Dr. Robert Vance. If you found this video helpful, please subscribe and hit the bell icon so you never miss a video. I post new heart health research for seniors every single day. And watch this video next, where I reveal the one blood pressure mistake that 97% of seniors make every single morning. Your heart will thank you.